I don't know about you, but I am getting sick of COVID. But the reality is, COVID is not going anywhere anytime soon. And I'm sure for those of you who are wondering, what is Medicare doing? What is Senior Healthcare Direct, MedicareBob's office doing? What are we doing to help people on Medicare through COVID? So I'm going to give you guys some updates on some of the changes Medicare has made, as well as some Medicare Advantage plans, and also what here at Senior Healthcare Direct, MedicareBob's office is doing to not only keep our employees safe, but also keep people that we're helping safe. So most of our employees, especially ones that are at risk, are all working remote. Other people that have to come to the office, we have masks, face coverings, we have hand sanitizer, and other places like that stations throughout the office. So things that we're doing to help people, our employees are staying safe, and we're also helping people enroll into Medicare. Unfortunately or fortunately, depending on the person's situation, we're talking to a lot of people that deferred their Medicare because they were still working and they had health insurance, but due to COVID, either they lost their job or it's not safe for them to go back to work, or they've just decided to go ahead and retire and take on their Medicare. Well, a lot of those people are having a hard time registering for Medicare Part B. So we've actually one of the only agencies that were in the forefront of this and worked with Social Security, and we've helped with Medicare and Social Security. There's been some changes on how they can sign up. For those of you that know, there's 2 forms you have to get filled out to sign up for Medicare Part B. The first form is the 40B form, and that is a form that you have to sign. So what we've done in our office is we will actually fill that form out for you, and we will use a system called DocuSign, where we can then send it to you right over your computer through the email. You open it, safe and secure, and you can apply your signature to the form 40B, and that will be the only form that you actually have to sign up for Medicare Part B. There's another form that normally your employer has to fill out, and the employer would fill it out about how long you've been there to make sure that you've had coverage since you were 65 past that. However, Medicare has allowed us to actually fill that form out with you, and nobody has to sign it. So the employer does not have to sign it anymore. We can get that form for you right over the phone, fill it out, and include that with your form 40B to sign up for Part B. Now, by not getting your employer to actually sign it, what they are requiring is a new condition, which is you just have to have some type of proof that you had health insurance through work. So the most common piece of proof we're getting is a copy of a pay stub showing a health insurance deduction. So with those 3 pieces of documents, the form 40B that we help you with, the employer form that now we can help you with, and we don't have to get signed by the employer as long as we have a W-2 or a pay stub showing that you had health deductions coming out of your paycheck to prove that you had health insurance. So that's something that we're doing. We've helped since back in March, we've helped over 2,000 people sign up for Medicare Part B. I think that's an advantage of our agency, is that we were at the forefront of that. And we were talking to people, in mid-March, and they were saying they're having a hard time signing up for Part B, and other agencies and agents were telling them that you can't get your Medicare or your Part D or Advantage until you get your Medicare card and get registered for Part B. So we hopped on the phone, made some calls, talked to some people, and got the approval to help people sign up for Part B. So since then, we've helped over 2,000 people just with Medicare Part B enrollments, which has really helped them out. And then we obviously help them with their Medicare coverage as well, which has helped us out. So if you're in that scenario, we'd love to help you get your Medicare Part B and then help you understand how Medicare works and help you find coverage. Now, Medicare has also made some updates, that being one of them, as far as not requiring the employer to fill out the form anymore. You can do it yourself and apply that coverage. They've also made some changes to help with during COVID, as far as how they do the care. One change they've made is they've expanded their telehealth. So I've got the link behind me, but I'm just going to kind of read here just to kind of give you some information. Medicare has expanded its coverage of telehealth services to respond to the current public health emergency. These services expand the current telehealth covered services to help you have access from more places, including your home, with a wider range of communication tools, including smartphones, to interact with a range of providers like doctors, nurse practitioners, psychologists, licensed clinical social workers, physical therapists, occupational therapists, speech and language pathologists. During this time, you'll be able to receive a specific set of services through telehealth, including evaluation and management visits, so like common office visits, mental health counseling, and preventative health screenings without a copayment if you have original Medicare. So, if you have Medicare and a supplement, you wouldn't pay for those things anyways, but now Medicare is covering those things as well. The other thing is you can also communicate with your doctors virtually. So you may be able to communicate with your doctors and certain practitioners without necessarily going to the doctor's office in person for a full visit. Medicare pays for virtual check-ins, brief virtual services with your physician or certain practitioners where the communication isn't related to a medical visit within the previous 7 days and doesn't lead to medical visit within the next 24 hours or your soonest appointment available. So again, they're expanding to virtual visits as well as telehealth. You do need to get consent verbally to using virtual check-ins, and your doctor must document the consent in your medical record before you use this service. So you have to call your doctor's office and make sure they're on board on how to bill it correctly. That's going to bring me to my next point, is there's tons of missed billings happening right now, so don't be in a rush to pay those. I'll talk about that in a little bit. Now, for those of you that may not have a smartphone or a computer or a laptop, since some people don't have access to interactive audio, video technology needed for Medicare telehealth services, or choose not to use it, even if it's offered by their practitioner, Medicare is allowing people to use audio-only phones. So now you can do just a regular phone call as an office visit, and now Medicare will cover that. So that's a big deal, because I do have some low-income clients that, I shared the expansion of telehealth about 6 weeks ago with COVID, and we got some feedback on YouTube and our Facebook page. Bob, I don't have a smartphone or a laptop. I just have a regular phone. So now Medicare is even expanding that more to allow you just to use your phone. Other ways Medicare is helping is Medicare Advantage plans and your Part D prescription plans may waive or relax prior authorization requirements. So what is prior authorization? Prior authorization is where you have to get a form filled out by your doctor stating that you really need that medication. That's normally a tool used if a doctor prescribes a brand name med. It's a way for the insurance company to make the doctor re-verify that you have to take a brand name. So now they've kind of relaxed that a little bit or waived it with Medicare Advantage and Part D. Also, another big change, and I think this is very helpful, especially because we saw in Italy where the hospital systems got overran, and then unfortunately there were some elderly people like in hallways and stuff not getting treatment. So what Medicare has done is they've expanded their skilled nursing facility care. So what is that? So typically, if you go into the hospital, you have to have a qualifying hospitalization in order to get skilled nursing facility care covered by Medicare. But Medicare, and what that is normally you have to be in the hospital admission for 3 days, and then Medicare, if you do get moved to a skilled nursing, will cover you for the first 20 days. Well, Medicare has kind of relaxed that hospitalization requirement. So to enable, I believe they're doing that to enable using skilled nursing facilities as overflow for older people that have COVID, who maybe can't go home for either they can't take care of themselves, or maybe they don't want to go home because, who's the high risk categories? You got people over 65 or people with pre-existing conditions. So if you're married and your husband at 70 years old gets COVID, and he goes and gets treated for a couple of days at the hospital, well, we don't really want that person going home and infecting their wife who might be 67 years old. So I believe one of the reasons Medicare is doing this is to give the flexibility. So if you have 2 people living in a house and one of them gets COVID and they go in the hospital, and even if that person's feeling okay, but we don't want to send them home because then they're going to infect their spouse, but the hospitals are getting, in some areas, overcrowded. So what can we do to help with that? And so that's where they're relaxing this hospitalization requirement for skilled nursing. So maybe they go in for a day, they're feeling okay, and now instead of having to wait 2 more days taking up a bed in the hospital, and they don't go home and infect their spouse, now they can go to a skilled nursing facility, get the care they need, and not infect the rest of their household. So I think Medicare is trying to do a lot. There's only so much that can be done with this, but they're trying to do a lot. If you go to their website, I'm going to post a link. They give a lot of good hygiene tips. As we all have seen it, wash your hands, face coverings really help. And try to stay safe. And that's the main goal I think that everyone wants to do, is stay safe. I will tell you the ugly side of this is we are seeing a lot of missed billings right now. It even happened to touch home in my family. My mother-in-law actually got misbilled for something and was having a hard time dealing with it. She's a client of ours. She actually came over. She walked around to the side because she's not coming in our house. And we stayed 10 feet away, and she gave me the bill, and we had to call, and we have a whole team of customer care and support staff that helps out with those things. But it took 2 weeks to get that resolved. So my advice to you is, this is a process even for the hospitals and billings and stuff. So if you get a bill, don't be in a rush to pay it right now. If you'd like our help to take a look at it, but if you don't think you should pay it, I would hold off, because again, it's a learning experience for the billing departments and claims and everything like that. So, there's a lot of preventative care and testing. For example, another thing that Medicare is doing, and I have it listed in the text of this video, which will be on our Facebook page and our YouTube channel, but Medicare is covering lab tests for COVID-19. So whether you have a Medicare Advantage or a Medicare supplement plan, if you go get the test for COVID, you should not have a copay for that. However, what are we seeing? I'm getting phone calls from clients telling me that they're being charged a copay for that. So, you don't pay that. Do not pay that copay if you're going to get tested for COVID. Also, Medicare covers FDA authorized COVID-19 antibody tests. So if you were diagnosed with a known current or known prior COVID-19 infected or suspected current or suspected past COVID-19 infection, so it's covering the antibody test for no copay. And then Medicare covers all medically necessary hospitalizations for COVID. So this includes if you're diagnosed with COVID-19 and might otherwise have been discharged from the hospital after an inpatient stay, but instead you need to stay in the hospital under quarantine, you'll still pay for the hospital deductibles, copays, and coinsurance that apply, but the additional days Medicare is going to help out with. Now, if you have a supplement, it's going to pay those hospital bills. If you have Medicare Advantage, you might have to pay the per day copay. But again, I just would not be in a rush to pay anything. I would get the bills, maybe make contact with them and say, listen, I'm not sure I'm supposed to pay this, so let's wait. As long as you're communicating with them, I don't think you'll have an issue down the road. If you have Medicare Advantage plans, so those are the Part C, the private alternatives to Medicare, you have access to the same benefits. Medicare allows these plans to waive cost sharing for COVID-19 lab tests. Many plans offer additional telehealth benefits and expanded benefits like meal delivery and medical transport services. Check with your plan about your coverage and costs. Here's a warning. Here's a scammer warning, okay? Scammers may use the COVID national emergency to take advantage of people while they're distracted. As always, guard your Medicare card like a credit card. Check Medicare claims forms for errors. And if someone calls asking for your Medicare number and you did not ask for that information, don't give it to them. Now, obviously, if you're working with a Medicare agency like us that's licensed, certified, insured, and all that EO and E&O, and we're a real company, we're helping you get coverage. Obviously, we're going to need your Medicare number. But if someone's just calling you randomly that you did not ask for help with, definitely don't give that out until you can verify who that is. So stay safe. I hope everybody, I just say, I'm just kind of sharing with you what I share with our team internally and my family is, we're going to get through this. Just try to stay positive, stay safe, do your part to keep everybody else safe. When it comes to Medicare, that's where Senior Healthcare Direct, MedicareBob's office can help. So if you have any questions about Medicare, we don't have to sell you to help you. Even if you have a plan already and you just want to ask, hey, am I supposed to pay this bill or what can I get covered? All of our agents, everybody that you're gonna call is a licensed AHIP certified Medicare specialist and agent. So not only are they a licensed health insurance agent, but they're also AHIP and carrier certified with Medicare Part D, Medicare Advantage, and of course Medigap, Medicare supplements. So we're just a resource for you. Please lean on us. Facebook or YouTube's a great way. Leave a comment and I'll be happy to answer it. But yeah, this is just our Medicare COVID-19 update. Medicare is trying to do a lot to help, so don't rush to pay bills. If you need help signing up for Medicare Part B because you lost your job or you're just thinking it's not safe to go back to work, so now you want your Medicare, our office has been the best of any other Medicare agency in helping people with that. We have a great process for that. We've helped over 2,000 people getting their Medicare Part B, so we're seeing a great response on that. So we'll be happy to help you. As always, if you just have a Medicare supplement plan and you've got more time on your hands and you might think that you're overpaying on your price, give us a call or go to our website and shop the prices. You can shop your Medicare supplement plan all year long. I've got an update coming for 2021. I've seen what the Medicare Advantage and Part D plans are going to look like. So follow and subscribe to our YouTube channel. Join one of the over 100,000 people on our Facebook page, and I'll keep you updated on everything going on with Medicare, even for next year. But of course, if you have a question, the best thing to do is just give us a call. We'll have a licensed certified agent answer, and you can ask whatever question you have. And if they don't know the answer, we'll find it. So stay safe. If you have any questions, let us know. Other than that, take care.